everyone. I want today to discuss on some of the measures of coping with COVID-19. Like some business have been meeting with the issues of COVID-19, which led them to not operating properly. So today we are going to discuss how those businesses can use some different measures so that they could continue operating properly. Okay, now you can start our discussion by highlighting some of the objectives. Like you have to synthesize about the effects of coronavirus. You have to show how these virus have affected some different businesses. We have to educate workers or the employers about preventive measures that could be taken so that their businesses could move forward and bring forward some strategies they could use in the process. So moving forward. Now we can continue with some of the symptoms of COVID-19. There is coughing, there is high fever, there is breathing difficulties, and also pain in the throat. All those symptoms do not occur at the very same time. Like they have a period of time. It takes some days all for different symptoms to occur. Like first you start coughing, you will start having high fever, but not all at the same time. We can watch a video which explains more about it.
Day-to-day symptoms of COVID-19. Before proceeding, please note that this general overview is compiled for initial self-assessment only and may vary for each individual. If you are not feeling well, you should immediately consult a medical practitioner to have an accurate diagnosis and proper treatment of COVID-19. The typical daily symptoms are concluded from the study of 138 patients at Zhongyang Hospital of Wuhan University, and another study involving 135 patients from Jinyintan Hospital and 56 patients from Wuhan Pulmonary Hospital. These symptoms are broken down into Day 1 to Day 2. The beginning symptoms are similar to the common cold, with a mild sore throat and neither having a fever nor feeling tired. Patients can still consume food and drink as usual. Day 3. The patient's throat starts to feel a bit painful. Body temperature reads at around 36.5 degrees Celsius. Although it's uncommon, other symptoms like mild nausea, vomiting, or mild diarrhea are possible to set in. Day 4. Throat pain becomes more serious. Other symptoms like feeling weak and joint pain start to manifest. The patient may show a temperature reading between 36.5 degrees to 37 degrees Celsius. Day 5 to 6. Mild fever starts. The patient show a temperature reading above 37.2 degrees Celsius. The second most common symptom, dry cough, also appears. Dyspnea or breathing difficulty may occur occasionally. Most patients in this stage are easily feeling tired. Other symptoms remain about the same. These 4 symptoms are among the top 5 key indications of COVID-19.
So from the video now, you can see when a colleague is having some of those symptoms, you need to hurry and take them to the nearest health center so that they could get immediate help. So moving forward, let's look at some of the effects of COVID-19 had on businesses. There were some business which temporarily closed during the COVID-19, like bars, yeah, in restaurants in the first months. Those businesses closed down. They weren't working like for how many months? Like 6 or 7 months. So these led to the reduced earnings. Some of the businesses even fired some employees because like it was hard paying them while they were struggling working. They increased salary demands due to inflation. During COVID-19, on the market, prices rised very high. So it was hard for the employees to afford those goods like their basic needs. So they were demanding an increase in their salaries. And there were some export restrictions. This was in order to reduce the transmission of the virus from one country to another, so there were export restrictions, and those businesses which involved in exporting, like you understand, their earnings reduced. So moving forward, we can talk about how to prevent COVID-19 and in our workplace. So there is hand hygiene, like employees have to make sure they wash their hands often, because COVID, like, it stays in their hands when they tend to shake hands with someone who is probably infected. So you have to make sure that you keep washing your hands more often. Secondly, social distancing. You don't have to stay near, because the COVID-19 is transmitted through breathing. So you have to maintain the social distancing. Like, you don't have to be in a very squeezed place when you are too many. You have to maintain this social distancing, probably like 1 meter or 1 meter and a half. Avoid large group meetings. Like I was saying, you don't need to be in a room which you are many and you are squeezed together. So you have to avoid those large group meetings. You can use online meetings, video calls, things like that. Avoid shaking hands or touching. Like, even though you have to wash hands more often, like, you can consider when you forget it. So you have to avoid shaking hands. You can come up with other ways of greeting people without shaking hands. Wearing a face mask, because this COVID is transmitted through breathing. You can keep on your mask so that you can avoid like sharing the same breath, even though the face mask might not be 100% protective, but it's not like bare noise. Yeah. So moving forward, we can discuss how to recover from COVID-19 issues. So this identifying healthy and security issues. You have to make sure that there is health and safety precautions you have took, so that you can stop further transmission of those remaining issues. Second, preparing a well-defined communication plan. During a crisis, communication is essential. Your communication strategies should focus on your team members, clients, and suppliers. Moving forward, reaching out to customers. You have to make sure that the communication you are communicating with your customers, you know what they need. You can also collect their feedback, so that you can focus on your team members, clients, especially here, and also suppliers. Reaching out to suppliers too. And the other thing, you have to evaluate the resources available for operating. Do the employees have enough resources to keep operating? Do we have sufficient people to work on this task? And lastly, comparing a plan for cash flow. Your cash flow, obviously during COVID, we shift in a lockstep with any short term. So you have to make some adjustments in way you are conducting your business. So now that you have some very precise tactics at your disposal, you can establish precisely how much working capital you require by combining them into this cash flow we are talking about. So moving forward, we can look at the COVID cases in Rwanda, differencing to according to the odometer. Like, they also reference to the Rwanda's RBC. As you can see, the numbers, the cases of COVID-19, they keep rising. They kept rising during the 2021. It didn't like slow down. Number, like you can see in February, the cases were 19,000 in February. And you can see is the difference in December. The cases are now like 109 and so you can see that the cases kept rising. So employees or businesses can take note on this. Like if there's those measures mentioned area are not like adhered, so these numbers will keep rising. So people need to adhere to those measures like wearing masks, avoiding large group meetings so that these numbers can stop rising. So moving forward, we we can look at some of the questions businesses might consider so that they could move forward. Like what is the expected time for recovery? Like we have struggled during the COVID, so how much time do we need so that we can recover? There are these factors that would help them. Like what do we need? Is it employees? Is it resources? What do we need so that we can recover? Is it the capital? Questions like that. What strategies can best suit the process? Do we need to invest more capital? Do we need more energy from people? Do we need a lot of resources, materials? What strategies can best suit the process? Does the workers have necessary resources? Questions like that. So moving forward, there is the task for businesses owners. Like these are things business owners need to take into consideration. There is tracking progress of employees. You have to be near your employees. Make sure that you are controlling, that you are overseeing their work, making sure that they are in line with the set objectives. Providing feedback to employees. You watch what the employees are doing. Make sure you give them feedback so that they can know what you really want to achieve and how they could go. Is the supervising employees cross like being near them? Like they have struggled, so you have to be near them to guide them, to show them the way. And continuing with those tasks for the employer, there is also planning ahead. The employer needs to make sure that his plans are ahead of time. Like those workers are not going to wait for the plans. Like they are not just going to sit there and wait for plans to come up. So the owners of the businesses need to make their plans ahead of time so that they don't keep their employees waiting. Investing mass time mostly in finance. This is crucial because, like we said, prices have risen on the market. There is financial issues during the COVID, so you have to make sure that your finances are managed properly. Like you can't invest what you don't have. Understanding the cash flow, this goes together with financial issues. You have to make sure that this financial is crucial, making sure that and last is making sure that their orders are heard clearly. You have to make sure that you communicate your orders clearly to your employees. Thank you, and this would be our best time for some questions and answers. Thank you for your time.